So, and this is getting into a little bit more detail, and we don't have to go too detailed on it. So, you said kind of nipple breakdown. Are there some really quick, easy signs where moms can tell, hey, this latch is not right? Is there anything about nipple shape, or would you recommend at that point probably just saying, hey, it's time to see, lactation consultant. Let's not try to figure this out on our own.
I wouldn't try to figure it out on your own. You can definitely go down the rabbit hole of the internet.
Mm-hmm.
The nipple shouldn't look misshapen. So if it looks wedged or lipstick tube like, some people will describe it that way, um, then it could be that the baby is not latched well. But again, I wouldn't read too much into all of that, because sometimes babies can do that when they're hanging out at the breast and not feeding. That doesn't
Mm-hmm.
necessarily mean that there's a latch problem.
Right.
Yeah, I would counsel on further advice at that point if you're having persistent pain beyond the 7 days.
Okay. And what are some, so when to seek help? We talked about, extreme nipple soreness, nipple
Mhm.
breakdown. Um, One of the other things I guess we can talk about, mastitis, as far as signs of mastitis. Is that something that you see commonly in the newborn period, or is that usually a little bit later?
We don't typically see mastitis in the newborn period. Um, Not to say that it can't happen.
Mm-hmm.
Um, One of the biggest culprits of mastitis is ineffective milk removal.
Okay.
So when milk stays in the breast for a long period of time, or a plugged duct that is not effectively removed, that develops into mastitis. Anytime that a mom is running fever, that's something to be concerned about,
Okay.
especially in the postpartum period. It could be a number of things.
Right.
But fever, redness, or warmth to the breast, really tender area, those will be, kind of warning signs of mastitis. At that point, we would want those moms to seek help either by talking to their OB, their general practice physician, the pediatrician. I'm sure is also a good resource to counsel on mastitis. You can call the Arkansas Breastfeeding Helpline, and we can give you some kind of advice on that. We can't prescribe any medication,
Right.
uh, but we would kind of give our recommendation on how to troubleshoot if it is mastitis, and then some other things that you can do to work through. A really important point about mastitis is that you want to continue to breastfeed. A lot of
Mm-hmm.
moms think they should stop because they have a breast infection, and that's actually the can do more harm than continuing to feed. So you'd always want to keep that breast emptied and continue the feeding process.
So what are some other, just kind of if we were to think of a list of, okay, this is when you really need to seek help. We're having some issues with breastfeeding besides, the nipple pain. What else?
So definitely pain. Anytime that you're having concerns with the baby's latch, even if it's not uncomfortable, but you just don't feel like the baby is able to remove milk, and that is as evidenced by you're not having good wets and dirties, you're not having good weight gain.
Okay.
Um, that would definitely be a reason to come see a lactation consultant. If you're at 2 to 3 weeks after birth and the baby is still pretty far from birth weight,
Right.
even if the baby is feeding very frequently, I would certainly seek help. And also know that it's not over. Even if it's not going well at 2 or 3 weeks, that doesn't mean the end of breastfeeding. With some good advice and assistance, we can usually get that turned back around.
So I know you mentioned the Arkansas Breastfeeding Hotline. What are some other resources you would recommend, whether, in person, telemedicine, on the phone for moms that have concerns?
So the Arkansas Breastfeeding Helpline is perhaps one of the best resources that I would want all moms to have in their phone, because we can help with things throughout the entire lactation process. But in addition, WIC is a really great resource
Okay.
um, that they usually have lactation consultants in a lot of the WIC offices that can help with positioning latch, nipple concerns. We also here at Baptist Health have Expressly for You, which is an outpatient lactation clinic that we can bill insurance. We can also do self-pay if that's a choice that you may also would be interested in. We can do appointments in person and now virtually.
Okay.
We've also just recently launched here at Expressly for You. We do free prenatal counseling through virtual appointments. Having some good advice before coming into the hospital, before giving birth. Um, I definitely say don't have too much advice before you come to the hospital. You may have a preconceived idea of what it's going to be
Right.
like, but some good tips and some good ways to really get breastfeeding off to the best start can be
Great.
really helpful.
I did not know about the prenatal appointments, so that's great. The prenatal consults.
This
What?
is a new thing that we have just started doing.
Cool.
And we've always done prenatal consults
Mm-hmm.
and build insurance, but these are free consults that we're doing virtually.
That's great. I'm so glad to have that accessibility. Anything that you would recommend for an expecting mom? Again, like you said, you don't want to get too much advice. I agree with that completely. I may have fallen into that category when I was expecting. But what are some things moms can do to be prepared or just to know maybe a little bit about breastfeeding before they go into the hospital to deliver?
Um, there are prenatal classes. Most hospitals do offer prenatal breastfeeding classes through their prenatal class curriculum. But another really great resource is through the Healthy Active Arkansas website. There is a free online prenatal course called Ready, Set, Baby that is about a 30-minute video. That video is also housed on the Baptist Health YouTube page. You can search Baptist Health Ready, Set, Baby and have access to that video. But it's packed with really great information to really get breastfeeding off to a good start without being too much information. It's just the right amount to really kind of hopefully answer a lot of questions that a lot of expecting moms may have. They can also always call the Arkansas Breastfeeding Helpline. We can also
Mhm.
answer prenatal questions as well.
Great. So I think, we've covered a lot of good information as far as, first steps of breastfeeding and establishing milk supply, how to know if baby's getting enough, kind of some options for troubleshooting, and then also kind of normal feeding patterns for a breastfeeding baby. So I think, a great kind of intro to breastfeeding basics. Was there anything else, you wanted to add or,
I don't think so. I could talk for hours about
I know.
about breastfeeding. So yeah, we would love to help women meet their goals. And those goals may look different for each. Everybody has different ideas of how to reach their breastfeeding goals.
Mhm.
And so we really, nobody here is going to judge what your goals are. We would like to help you meet your goals. Um, because we know there are so many benefits to breastfeeding, and we want to give you all the knowledge.
Yeah, I would totally second that as a mom and just say, even if it's different maybe from baby to baby and just to reach out for any kind of help you think you might need. There's no question that is dumb, or even if you feel like, hey, this should be totally natural, why is this not so easy? That's okay and that's normal. So reach out to your pediatrician, to the nurses at the hospital, to the lactation consultants. We are all here and want to help moms and babies. So I just want to thank you again for
Thank
doing the
you.
interview for me, and maybe we'll get to do some more in the future. Thank you so
Love
much.
that. Of course.